Hello, my name is Dr. John Fagan. I am a board-certified family physician who has a special interest in Ehlers-Danlos syndromes. I have the opportunity to speak about this topic, and I thank Casa Colina for giving me this opportunity. So this presentation is mainly for patients and the general public. We will have another program specifically for healthcare providers if they want to go in a little bit deeper into this topic. So this slideshow that I will be speaking over is presented by the Ehlers-Danlos Society, which is a society that has done a lot of work internationally to promote the knowledge and information about Ehlers-Danlos syndromes. So what is Ehlers-Danlos and what's called HSD, which stands for Hypermobility Spectrum Disorders? So that in 2017, there was a group of specialists who had interest in hypermobile disorders, including geneticists and rheumatologists who, mostly based on genetic criteria, have described a new classification system for Ehlers-Danlos syndrome. So these are groups of diseases that are mostly related to connective tissue disorders that are likely to be inherited. They certainly can be varied in how they affect the body and their genetic causes, but it's thought to be caused by joint hypermobility, skin hyperextensibility, and tissue fragility. They can cause symptoms throughout the body requiring medical attention and validation, period. The groups of conditions involving joint hypermobility for hypermobile spectrum disorder can cause symptoms throughout the body similar to the Ehlers-Danlos syndromes, and really, it's a diagnosis of exclusion after you've ruled out other conditions of all the other EDS subtypes, but in general are thought to be treated similar to the Ehlers-Danlos syndromes. So first we're going to talk about the Ehlers-Danlos syndromes, and there's 13 different types that have been identified. They are generally characterized by groups of connective tissue disorders that can be inherited. There's also cases of spontaneous mutations, and they can be quite varied in their effects and causes. They're generally characterized by joint hypermobility, skin hyperextensibility, and tissue fragility, including the skin and sometimes other organs in the body. They're also known to affect men and women of every race and ethnicity. Connective tissue are material in the body that supports tissues and organs and also separates tissues and organs. The connective tissue provides strength, flexibility, and general functions of the body, and can also provide specialized services as found in the cornea, for example. These connective tissues are disrupted. When they're disrupted, they can cause fundamental problems with many parts of the body, which can be widespread and have a wide range of severities as well. They can even affect areas that seemingly are unrelated to the connective tissue in question. So the next couple slides will talk about how these 13 different types are classified, and 12 of which are based on genetic criteria. There are genetic sequence bases for the different types, and I'll go through these relatively quickly. The majority of these are quite rare, and most doctors will not see these, but I'll go through them to kind of just give you a general idea. So you can see in the first table, all of these have genetic sequence basing except for the hypermobile EDS, which currently is unknown as far as its genetic basis. and work is currently being done to try to identify these genetic sequences. And these are the other ones, and we'll talk quickly about each one of these. So the first one is classical EDS, and this is a heritable connective tissue. That disorder affects collagen. Most people with this have joint hypermobility and have very extensible and fragile skin with easy bruising and scarring. They can also have pain and joint mobility causing joint fragility as well. The hypermobile EDS is thought to be the most common genetic connective tissue disorder. It may occur up to about 2% of the population, according to some studies, period. These patients will often have joint hypermobility with subluxations and dislocations. They'll have skin issues, and oftentimes will have a myriad of other symptoms, including chronic pain and fatigue, involuntary nervous system issues, such as heart rate, blood pressure, temperature control. They often have gastrointestinal issues, temporomandibular joint and mouth and dental problems, spine problems, and a condition called mast cell activation disorder, which we'll talk a little bit about. Vascular EDS is a relatively rare disorder, and this is the most serious form of Ehlers-Danlos, as it causes arterial aneurysms, which are dilatations of the arteries. They can have dissection where the artery kind of can become compromised because of the softness and fragility of the tissues, and also ruptures as well. Patients often will have ruptures of bowels and uterus. They do have a reduced lifespan because of their significant possibility of rupturing the internal organs. If these people are diagnosed, it is important for them to have a team to help take care of them, because they can often present with life-threatening situations quite commonly. Blood pressure is very important to control in these patients due to the risk of rupture of mainly of the major arteries of the body. Classic-like EDS is a rare disorder that also has hyperextensible skin, easy bruising, generalized joint hypermobility with or without recurrent dislocations, and poor wound healing. And these can be differentiated and identified by genetic testing. There's cardiac valvular EDS, which is a rare disorder that causes the same joint hypermobility. However, this seems to be smaller joints. There is skin involvement and a severe progressive heart valvular defects that often require heart valve replacement in adulthood. The Arcarthrogalatia form of EDS is a rare disorder that these patients have severe joint hypermobility and born with bilateral hip dislocations, as well as skin hyperextensibility. Dermatosparaxis type of EDS is rare as well. Severe bruising along with extremely fragile skin. Scoliotic type of EDS. These patients are born with reduced muscle tone. They develop early kyphosis, which is a hunchback of the thoracic spine, the mid-back, and they have also generalized joint hypermobility. Genes associated with these under this classification can cause. Brittle cornea syndrome is also a rare disorder that causes a thin cornea, and the cornea tends to tear spontaneously or with very little trauma. They also have a more prominent blue sclera, which is the white part of the eye. They have joint hypermobility with mild skin involvement. Spondylodysplastic EDS, also rare. These patients are short stature, reduced muscle tone. They have bowing of limbs and delayed motor and cognitive development. Musculocontractural EDS is also a rare form. These have the characteristic facial that are associated with this, and they have multiple contractures at birth, including the thumbs that are across the palm and also club feet. Also have progressive spinal foot deformities. Myopathic EDS, also rare, muscle weakness, hypermobility, and contractions of large joints. Periodontal EDS is also quite rare. These patients have severe gum disease in infancy with significant loss of teeth and damage to the gums. The skin can also be easily bruised and fragile. We went through the 13 different types. What we're going to talk about more is the more common components of, the more common forms of EDS, which are the hypermobile type, as well as partially the classic type, and the condition called hypermobile spectrum disorder, which we'll talk about a little bit more. The most important thing about this spectrum of diseases is to try to make this diagnosis early, so it's important for you to seek out medical care. It's largely preventive to prevent physical damage. The earlier the diagnosis, the better prognosis for patient health. And since there's such a wide range of presentations and symptoms, each individual's experience with EDS is their own. So the hypermobility spectrum disorders is essentially classified as a group of patients that have hypermobility, but they don't necessarily meet the clinical criteria of hypermobile EDS, and they don't have the genetic basis for the other forms of EDS. So it's essentially a diagnosis of exclusion. There's no genetic test for this either. So joint hypermobility can be either localized or affect all the joints. Hypermobile spectrum disorder can range from just generalized joint hypermobility with no other symptoms to complex hypermobile spectrum disorder that can have the same life-altering symptoms as hypermobile EDS. And essentially, those people that have hypermobile spectrum disorder should be treated as if they have hypermobile EDS. So the joint hypermobility is defined by a scoring scale called the Beighton score, and they use 9 different joints of the body, which is the fifth finger on each hand, the thumb on each hand, the elbows and the knees, and then the back, to determine the hypermobility of patients. So patients who have joint hypermobility in fewer than 5 joints is considered localized joint hypermobility, and joint hypermobility in 5 or more joints is considered generalized joint hypermobility. Because the joints can change with age, the relative diagnosis of hypermobile spectrum disorder the diagnosis can be changed somewhat based on the patient's age, because as these patients age, their joints become stiffer and more difficult to diagnose. This is possibly inherited, this hypermobile spectrum disorder, because it's such a wide range of presentations. The genetic basis for this has not yet been identified. The peripheral joint hypermobility suggests that those apply to patients who have that are affecting the hands and feet only. And again, historical joint hypermobility is found in older adults who have progressively lost their joint hypermobility. So in other words, just because someone currently is not hypermobile does not mean that they don't necessarily qualify for hypermobile spectrum disease. There are a number of different subtypes. So again, the Beighton score would be, in general, for patients who have 5 or more joints, they would have the presence of generalized joint hypermobility. And these are just the different presentations of hypermobile spectrum disorder. So they can either be generalized hypermobile They can be localized hypermobile joints, or they can be peripheral, or they can even be just historical. And there are questionnaires that we can use to help figure this out as well. So really, the rest of the presentation is mainly due to, or we'll be covering the manifestations of joint hypermobility with respect to all cases of EDS, but more specifically to hypermobile EDS and the hypermobile spectrum disorders. So the secondary skeletal or muscular manifestations include joint damage from recurrent dislocation or subluxation, which is basically just a small movement of the bones within the joint because it's too loose. And there's also, that's called macro trauma, where actually things are moving. And micro trauma refers to injuries that are too small to be noticed as they happen. However, this can cause chronic degeneration of the joint, and one of the things that is thought to contribute to premature arthritis of the joints. There's also chronic pain associated with Ehlers-Danlos Syndrome, and as a general rule, there's a couple of different kinds of pain. There's generalized what's called musculoskeletal. We use a term called nociceptive pain that occurs as a result of trauma to a joint, just as if you dislocated a joint or broke your foot, that kind of pain. There's also chronic pain that is associated with chronic brain kind of sensitivity to the chronic pain, what we call neuroplastic pain, where the brain fibers start firing on their own, and this is more of a generalized type of centralized pain that can occur as well. A lot of people with EDS have disturbed what's called proprioception, which is the ability of your body to know where your parts of your body in space. So for example, many patients will complain that they're clumsy, or that they run into walls easily, or they drop things. Oftentimes, these people will have flat feet as well. They'll have misaligned bones in the elbow and big toes. They oftentimes will have moderate scoliosis, which is a curvature of the spine, kyphosis, where you get the humpback appearance of the back of the spine, and lordosis of the lower spine is when it's an exaggeration of the lower spine, where their top part of their body is actually back further than it should be. There is an indirect association with mild reduced bone mass as a result of many factors, including chronic pain and reduction in physical activity. So there are many problems that are associated with EDS that are not based in a musculoskeletal system. These are oftentimes somewhat difficult to diagnose by doctors, and oftentimes patients have felt that they're not listened to. I'm sure many people listening to this have had that same experience, but these are very real, and with further testing, oftentimes we are able to identify exactly the physical abnormalities associated with these. These issues that are not associated with the musculoskeletal system are they affect the quality of life significantly, and must be taken seriously. There's also associated anxiety disorders, and we'll talk a little bit more about that. Orthostatic tachycardia essentially means when you stand up, there's an inappropriate fast heart rate that occurs that can cause feeling of a fast heart rate, but also feel lightheaded or actually passing out as well. There's a variety of gastrointestinal disorders manifested by chronic abdominal pain, bloating, nausea, and change in bowel habits. There's oftentimes pelvic and bladder dysfunction as well. Talk a little bit more about those and the associated conditions. So in general, in treating these conditions, physical therapy is one of the mainstays, especially in a environment or a institution that has a lot of experience with Ehlers-Danlos. There are some forms of physical therapy that can be damaging if it's not done properly. So it's important when you're choosing physical therapy to choose a group or facility that is very experienced with this, because it can make a big difference. So in the guidelines with physical therapy, we're going to individualize that for each patient, and it's useful to address the pain balance, the proprioception, which is the ability to know where your body is in space, the tone of your muscles, and your overall physical fitness. Guidelines for treating autonomic dysfunction. Again, this is what I like to say is just your involuntary nervous system is not working properly. So things like blood pressure, gut motility, those things. In treating these, there are a number of options of ways to treat this. These are very common in hypermobility related disorders, and pulse and blood pressure is one of them. Oftentimes this is very significantly affecting the quality of life. So these changes can cause a fast heart rate, sometimes slow heart rate. You can get low blood pressure, sometimes very labile blood pressure. You can get all kinds of gastrointestinal problems and bladder issues, as well as temperature regulation can be an issue, sweating too much or too little. Most conservative approach is to make sure that you have enough fluid and salt intake. Compression stockings are usually quite helpful. Physical therapy can be helpful for these as well. And there's a number of different other medical interventions that can be done for these problems based on more accurate diagnosis. Chronic fatigue is a very common component of this. And the symptoms can overlap what's called the chronic fatigue syndrome, which has its own set of diagnostic criteria. But there's thought also to be many causes that cause chronic fatigue. There's oftentimes trouble with sleep disorders, chronic insomnia, chronic pain that'll affect both sleep as well as energy level, deconditioning from lack of physical activity because of the underlying problem, and psychological issues, and also, very importantly, nutritional deficiencies because of gastrointestinal conditions. So in the gastrointestinal disorders, these are also quite common. There are structural issues due to the loose ligaments, which can include prolapse of the rectum because the ligaments that hold the rectum in can be too loose. You can also have hiatal hernias, which is where part of the stomach is actually up in the chest cavity. And there's a number of other types of intestinal structural problems that can occur as a result of loose ligaments. And then there's the more common that I see actually is functional problems such as gut motility issues, chronic constipation or alternating diarrhea and constipation, and gastroparesis, which is often overlooked which is basically a slowed motility or paralyzation of the stomach. And we oftentimes will treat based on symptoms. There is diagnostic testing that we can do to document what these are. And there may be some added precautions for some GI procedures. There's because of the easy tearing of the connective tissue, any kind of intervention needs to be done with some caution. Orthopedic management, the Ehlers-Danlos diseases can cause early damage to the joints and joint instability. Orthopedic surgeons may be necessary for recurrent joints that are that really are not functional because of how loose they are. But in general, we want to avoid surgery because of potential poor wound healing. But if it's necessary, then it must be done. But as a general rule, we really like to work more with physical therapy and other non-invasive techniques. So because of both ligament issues and the mobility of the spine, you can run into multiple different spinal issues one of which is what's called cranial cervical instability or atlantoaxial instability, where the skull sits on top of the first vertebral bodies in the neck, and the ligaments that hold those together can be too loose, and that can cause chronic pain, headaches, and other types of neurologic symptoms. The Chiari malformation, which is where your brain, which is held up inside the skull by ligaments, can be too loose, and actually the parts of the brain can come down outside the skull where it's not supposed to be. Tethered cord syndrome, which affects the lower part of the spinal cord, and that can cause pelvic issues as well as lower extremity symptoms. You'll also get early disc damage because of the laxity of the ligaments, and microtrauma that can occur with the spine moving too much. That can cause premature degeneration of the disc spaces and chronic pain. You can also get muscle weakness, and migraine headaches are, in addition to all kinds of other headaches, are more common in EDS patients as well. The general treatment, physical therapy and bracing is the best treatment initially for these patients. Surgery may be needed if there's just frank instability of the joints that are not going to be helped with physical therapy. Pain is very common. Chronic pain is a very common component of EDS. And you can get different types of pain, as we talked a little bit about before, where you can get joint pain from ligament laxity, joints dislocating. You can also get abdominal pain, which we call visceral pain, get pain from the temporomandibular joint, chronic pain from headaches and migraines. There's a higher incidence of pelvic floor dysfunction, so you get chronic pain in the pelvic area. The management of chronic pain is sometimes a challenging issue as well. Oftentimes, the best thing to do is to try to get to any underlying cause that may be treated, but physical therapy, it can be quite helpful. There's different forms of medication that can be helpful for chronic pain. Bracing therapy can be quite helpful, and compression wear is becoming more commonly used for both improvement in proprioception, but also in chronic pain management. There's a higher incidence of dental and mouth issues, as well as jaw and temporomandibular joint issues, which is where the jaw meets the skull. There's soft tissues such as gum disease. Teeth have more prone to dental fractures. Temporomandibular joint dysfunction, that's a joint as like other joints in the body, and that can be too lax and dislocate, or it can cause chronic pain from early arthritis. And the treatment options really depend on the individual issue that's occurring at that time. Mast cell disorders. So mast cell activation syndrome is a relatively new syndrome that's being identified. It is seen commonly in those patients with EDS. Some studies suggest maybe up to 80% of patients with hypermobile EDS have some form of mast cell activation. And these symptoms can vary somewhat widely, but usually there's a manifestation of certain types of either generalized or localized swelling of skin or tissues, along with hives or itching. Generalized itching can also cause other weird sensations, including chronic pain and these things oftentimes react after certain triggers that may have brought them on. So mast cells are cells that are produced in the bone marrow that float around in the bloodstream for short periods of time, and then they deposit in tissues of the body, and they release these biochemical markers that control somewhat of the environment around them. So the idea is that these mast cells are not controlling these chemical mediators very well, and they release them into the tissues. So the idea is to try to manage these mast cells with trying to avoid the triggers that might cause it, as well as using some medications known as mast cell stabilizers. And this is becoming a more common generalized approach for a lot of patients with Ehlers-Danlos Syndrome. There's a higher incidence of of anxiety and depression, as well as other neurodevelopmental disorders, including attention deficit and part of the autism spectrum disorders as well. And the incidence of these things is above and beyond what you would expect from people having, anxiety and depression from their loss of quality of life. So there's, it's probably even above and beyond that. And these patients need to be, obviously treated with psychotherapy, proper medication, and reassurance that this is not just all in their head is extremely important, because validation of their symptoms is the most important thing that you can do for these people, because oftentimes they've been told for many years that there's nothing wrong with them and that this is all in your head. So it's extremely important for us as healthcare providers to take these seriously and treat them appropriately. So we here at Casa Colina have a Ehlers-Danlos Syndrome and Hypermobile Spectrum Disorder program. We can do initial evaluations as well as chronic treatment recommendations. We have specialized clinicians that are part of our programs, including cardiologists, gastroenterologists, neurologists, neurosurgeons, physical occupational therapists, radiologists, and others as needed. We also at Casa Colina have a strong community support program, and we now have also a patient support group as well. So if you are interested in learning more about EDS and our team here at Casa Colina, you can call 909-596-7733, extension 3800. Thank you very much for listening.